Before his final day in office, President Trump made some changes in medical policy that some are calling a victory in the war on opioids. The changes take down barriers that prevent doctors from prescribing the drug Buprenorphine, which is used to help fight opioid addiction. But the drug is an opioid itself. WFXR's Parker King spoke with addiction experts about what this means in the fight against addiction.
In a recent policy move, the Trump administration eliminated the requirement that physicians with DEA registration numbers apply for a separate waiver to prescribe buprenorphine. Buprenorphine, found in prescription drugs like Suboxone, is an opioid used to treat those with opioid addictions, and now doctors can prescribe it without any red tape.
That covers you from going through withdrawal for a full 24 or more hours, that allows you to start reconstructing your life, that has a minimal pharmacological effect on your consciousness. That's all win-win.
Dr. Warren Bickel with Virginia Tech's Fralin Institute says further access is a good thing, but he's concerned about this new policy because even buprenorphine can be abused if not administered properly.
It's, I think, useful for physicians to know exactly the pros and cons of different approaches and have that training.
I'm very excited about initiatives that improve accessibility to this medication.
Dr. Jeffrey Wilson is an addiction psychiatrist with New River Valley Community Services and has prescribed Suboxone for over 20 years. He says the drug, while an opioid, has receptor blocking properties.
If you use oxycodone over the right dose of Suboxone, it won't have any effect. If you use heroin, it won't have any effect. That's what protects that person with an addiction from overdose and death.
Bickel and Wilson say the stigma surrounding opioids is also an obstacle, and that doctors educating themselves on buprenorphine and how it can help addicts on the path to recovery could help Southwest Virginia and the country in the fight against opioids. Local in Blacksburg, Parker King, WFXR News.
The Virginia Department of Health's most recent report predicts total drug-related deaths in Virginia will number more than 2,000 in the year 2020.